We are live. Okay, welcome everyone to the City of Hartford's Court of Common Council Health and Human Service Committee. Thank you everyone for attending today, our our WebEx conference. And thank you everyone for who may be viewing via our HPA-TV and Facebook live streams. So we're going to dive right into the agenda. And so prior to the agenda, I want to go over some logistics regarding our meeting. So the first thing is that if you're not speaking, if you could please mute your microphone, so that way we don't pick up any background noise. And then the other thing as well is make sure that in the chat feature, we're not using the chat feature here. And so lastly is in terms of the council meeting, we're going to do introduction, but we have council committee members who are voting members today. And so when we do a quick introduction, just make sure that you say that you're a voting member. So we'll start with Councilman John Gale. If you could just do a quick introduction just to say hello.
Councilman John Gale here, and I am a member of the committee.
Thank you. Councilman Sanchez. You got to unmute Councilman Sanchez.
Councilman Sanchez here. I'm not a voting member.
Councilman Rosado, Council President Rosado. Got to unmute.
Good evening, Councilman Rosado, and I am a non-voting member.
Councilman Rossetti. Councilman Rossetti.
Councilwoman Rossetti, and I am a voting member.
Majority Leader Clark.
Good evening, everyone. Majority Leader Susan Clark, and I'm a voting member.
And then we have Corporation Counsel, Mr. Damar Osborne. Can you just introduce yourself quickly?
Damar Osborne, Assistant Corporation Counsel.
Thank you. And then we have Dr. Deverick Anderson. If you could just say hello, introduce yourself. Okay, move on. Dr. Anderson, are you there? If you can unmute yourself, Dr. Anderson.
There we go.
All right, we'll circle back. And so
Sorry, can you hear me now?
Yes, we can hear you.
Sorry about that. Yeah, my name is Dev Anderson. I'm a professor of infectious diseases from Duke University.
Thank you so much. And so we have our Director of Health and Human Service, Ms. Liani Arroyo.
Good evening, Liani Arroyo, Director of Health and Human Services for the City of Hartford.
Okay, and then just for viewing, for the folks that are viewing, we have Gil. If you could just say hello, Gil, from HPA-TV. No?
Good evening, everyone.
Okay. And then we also have Mike. Mike, if you could just say hello. No problem. Okay, we'll move on. And so we have council aides, Rachel and Eli. If you guys could just quickly say hello.
Good evening. Hi.
Hi. And Eli. You're on mute. All right, so we'll move on. So our first agenda item, Council Majority Leader Clark indicated to me that during our Health and Human Service Committee meetings, we do not approve from meeting to meeting. What happens is that it gets approved at our general council meeting. So thank you for that, Majority Clark. But what I want to indicate to everyone here is that just to give a rollover as to what happened on March 1st, is that we approved 4 agenda items for the Health and Human Services that were passed, and then were subsequently approved at the council meeting. But one of the other things that happened on the March 1st meeting was we discussed the coronavirus and where we were at that time. And so I just wanted to give an acknowledgement to the Health and Human Services Director, Liani Arroyo, and to the Health and Human Services Committee for being aware of the coronavirus, I think much more in advance to most municipalities across the country, and acknowledging and putting forward a plan that acknowledged the coronavirus and kind of put in preventative mechanisms in place. And so Dr. Toon, thank you to him. He was kind of spearheading that, I think, at that time, Yanni, if I'm not mistaken. And, communication was set out to all staff. And basically what was happening at that time, we were putting in measures and recommending if folks were sick to stay home, wash their hands. Again, that's been something that's been prevalent. Again, the washing of the hands from sick individuals. And then we were looking at flu pandemic plans. And there was a lot of, I think, a week worth of work looking at it and comparing it to the state and the CDC, I believe. And then you guys were kind of moving accordingly and changing things as needed. And then there was also a monitoring of people that were coming from China at the time. And then basically you kind of gave an overview as to what the CDC guidelines were to that point, and that we were reviewing those and you were using that as a kind of basic premise. And this was back on March 1st. So is that correct, Director?
Yes, Councilman.
Thank you so much. All right, so again, I thought it was just important to reiterate the work that the committee was doing, and then the work that the city was doing well in advance before, the stay safe, stay home issued by Governor Lamont. So we have a referred item on the agenda. And so for introduction, so the referred item is a resolution urging the Department of Health and Human Services and other departments to participate in the research and implementation of FAR UVC lights at all City of Hartford facilities and entrances and surfaces, i.e. the counters of City Clerk's Office, Vital Statistics Office, Tax Office, including but not limited to air handling, heating and cooling systems, etc. So we are lucky to have Dr. Dev Anderson. I believe he introduced himself, an MD, MPH, FSHEA, and a FIDSA. He's the director for Duke Center for Antimicrobial Stewardship and Infection Prevention, professor of medicine, Division of Infectious Diseases at Duke University Medical Center. So Dr. Dev Anderson, thank you for taking time out of your busy day. Thank you for joining us here in Hartford to talk about this resolution. So Dr. Dev Anderson, the floor is yours.
Thank you. Just to check, can everybody hear me okay?
Yes.
Yes.
Okay, great. Well, again, thank you for having me. And again, this is one of those topics where we could certainly spend a lot of time because there are some details to think through, but I thought I would start with just a little bit of an overview and why I suspect you ended up asking me to talk about this. And we've been using these UV robots in healthcare now for several years. And the idea was actually because of the antibacterial properties of UV light. And so for many years, these were touted. This technology technically came out of bioterrorism research from about 20 years ago or so. And these mobile units where you could take them into a room and then turn them on, and after a certain amount of time, consider the area to be better disinfected. And so we thought this was an intriguing type of disinfection. And the kind of the dirty laundry within healthcare is that we don't always do a good job cleaning surfaces in hospital rooms and healthcare settings as we might like to. And so we pursued UV light as a way to enhance our routine disinfection. And so we did a randomized controlled trial, 9 hospitals here in North Carolina, where basically we would find a room that we had high suspicion would be contaminated with germs, not viruses. So these were bacteria, but some of which you may have heard of before. So like MRSA is probably the one that most people are familiar with when you think of superbugs, right, in that term. And so we found that if you use these UV lights to help clean a room between people, and that's in the healthcare settings what we call a terminal disinfection. It's like a hotel. It's like an analogy, it's like the hotel room. You know, on a day-to-day basis, if you're in a hospital room, there's some minimal amount of cleaning, but the real deep clean is in between patient to patient. Yeah, that's a terminal disinfection. We found that when you added UV light to our terminal disinfection strategy, that we could reduce the risk of infection for the next patient in the room and for even other people in the hospital. And so since that study was completed, and it was probably about 4 or 5 years ago at this point, we've been using these robots in Duke University and many of the other hospitals in the area. They're being used in many other places, typically, again, with the focus on healthcare. Well, obviously, with COVID-19, the issue has now turned towards, can we think of other potential uses? And again, I'll put it out there. I don't think that we actually know with 100% certainty that these types of machines are going to augment the process in outpatient settings. But there certainly is science to back them up as far as being effective at just killing germs in general. And so, again, if you've seen one of these robots, there are probably 5 or 6 different companies that have these type of robots. And they move from, you can roll them from one room to the next. You typically, are controlled via remote control, so you're outside of the room or distant from the device, and then you can turn it on remotely. And most of them have visible light as part of their system, but that's mainly just so you know that it's on. It's actually, we can't see UV light. And so if they were on without that visible light, you wouldn't actually know that they were on necessarily. So the good news is that they work. It is really a time equation. What is the distance from the light and how much time are these UV lights shining on it? That's really what most impacts their ability to disinfect these surfaces. It's fair to say that they work better on harder, more reflective surfaces than they necessarily do on textiles. And the idea there is that you get a lot of reflectivity. These UV rays bounce around and you can get actually some disinfection even when they're shadow. And so again, there's certainly some appeal to using these. There are some logistical concerns to think through, however. You've got to be able to operate them safely. They don't take much training. They take a little bit of training in order to do so. But you also have to make sure that you have adequately prepared the area for one of these machines to be used, because again, the light won't get between surfaces if they're directly opposed one to another. So, for example, in a hospital room, we would go through multiple steps to make sure that there are different, we've angled the bed, we've opened up the drawers, we've opened up the door to the bathroom, things like that have all been done so that you get the most benefit out of using the UV light. The time varies between machines. In a hospital room, and we've all got a picture of what a typical hospital room size, what the size of one of those rooms may be. And again, the way to think about it is not necessarily the size from one wall to the next. It's really the volume of the entire room that you have to take into account. So there is likely then to be some limitations to their use in big, wide open areas. They're going to be much more effective in tighter and smaller rooms. But you can still, with some diligence, can still disinfect the main surfaces that you might try and disinfect. I think it's fair to say that this is not what we would consider to be a disinfection process on its own. I think it really is complementary to what you might consider to be your, chemical disinfection and elbow grease approach. You still will need to do that. There's actually some science that you really need to do that, because the more debris that is present, the more biological fluid or whatever else that may be present, then that actually impacts the effectiveness of the UV light. And so there needs to be some amount of cleaning before the UV in order to get the most bang for your buck. So why don't I stop there? Again, there's plenty more I can tell you about if you want, but this probably is, at least as an overview, is a good place to stop, and I'm happy to answer any additional questions you may have.
Sure, Dr. Anderson. Thank you again for taking your time out of your busy day and joining us today. We're very happy to have you on here. So what I want to do is I want to leave this open. Dr. Anderson only has a limited amount of time that he can be with us here. So I want to respect his time and everyone's time here. So if council persons or anyone here has a question, if you could kind of just, give me a wave. Okay, let me go ahead, Councilman Clark.
Thank you, Mr. Chair, through you. Thank you for your presentation, Dr. Anderson. Question regarding this research, where would funding be available to assist the city of Hartford in with this, and also to what's the cost as far as maintenance?
Yeah, so good questions, because certainly anytime you're talking about a device like this, you got to think about the cost component. And I'd say that's one nice thing about having several companies in this area. There is some competition amongst them as far as, trying in some ways to drive down the price. The big answer to your question is if you look at the different types of devices that are out there, they'll run you anywhere from $15,000 to $60,000 per device. And there's some different bells and whistles that each one of them may have as part of their overall package. In a hospital setting, we include these as part of our capital costs and believe that, we reap the cost savings from preventing subsequent infections. I think it is safe to say that specific funding would not necessarily be the way that a city would have to try and cover costs for this. And so I don't know in a city, in a municipal setting, what's going to be the best way. There is certainly a potential bit of advice would be that if you contact some of these companies, they get good press when cities like yours use their devices, and they're interested in that as much as anybody else would be. And that may be a way that you can negotiate some lower price that you can then tout on, in some ways on their behalf, that device is being used as a enhanced disinfection strategy in some of your municipal buildings.
Yes, Councilman Clark.
And my final question in respect of time, are there any other municipalities that you are aware of that actually has been able to purchase this said device?
I have at least heard that many have considered it. I will be perfectly honest, as I do not know of any that have purchased these. And that is maybe more reflective of my ignorance than necessarily knowing what all has been going on in some of these settings. I think it's fair to say that with this environment, there has been a lot more chatter on the infectious disease and prevention side of things about these devices. There are other types of enhanced disinfection strategies as well. Each one of them has its pluses and minuses. This one, because of its mobility, and I'd say relative efficacy, is definitely a reasonable one for groups like yours to consider when it comes to ways to enhance your disinfection. I will say that I think there's not only science behind this, but there's certainly something to be said for morale as well when you can tout an enhanced strategy for your disinfection.
Okay, Councilman Gale.
Thank you, Mr. Chair. Thank you, Dr. Anderson. You mentioned efficacy a moment ago, and you may have mentioned it at the beginning, and I'm not sure I caught it. Is there science at this point that demonstrates that this technology does have efficacy in eliminating the COVID virus, or is that still subject to research? And if it does eliminate the COVID virus, what is the time necessary for exposure? Are we talking about exposure of 10 minutes of light, or are we talking about 2 hours of light? And lastly, you mentioned robots being utilized remotely. So my question with that, is there a danger to humans from this when the light is being used?
Right, those are certainly good questions. And I should have mentioned, yes, in the big picture, coronavirus is very, very susceptible to disinfection, not only chemicals, but the UV light as well. When we go through the list of things that are hard to kill and things that are not hard to kill, the things that are hard to kill are things like spores and mycobacteria. The things that are easy to kill are actually viruses like coronavirus. And so there is not a paper out there that says specifically for SARS-CoV-2 that UV light kills it, but it is everyone's absolute assumption that it does, because it does kill coronaviruses in general. And again, in the big picture of these germs, it is one of the more easy to kill viruses in the environment. And so with that, yes, the remote setting is important because technically there are safety concerns related more to your eyes than your skin. The far UV is a more shallow wave, and so it's not believed to be a risk for skin cancer, but with extreme exposure, it can lead to cataracts. And so as a result, while on the big picture, there is an acceptable amount of exposure. We get UVC and far UV when we go outside for sure. But that said, there are specific safeguards that are in place for these because of that, really what's more of a theoretical risk. And distance, so then the third question was about time. Again, it is more easy to kill. In general, most of these machines have preset cycles that they will run. However, it is a matter of time and proximity. So you can be 20 feet away and it'll take longer than if you're 2 feet away to kill the things that are on those two surfaces.
Thank you, Dr. Anderson. So Councilman Sanchez?
Yes, thank you. Through you, Chair. Thank you, Dr. Anderson, for accepting the invite and attending this virtual meeting that we have. My question to you is actually three short questions. So the first one, the cost you mentioned is $15,000 to approximately $65,000. Is it possible that that cost can be reduced by using it in alternate ways? For example, at the Capitol, we have the metal detectors, which is stationary, it's a frame. And my thought is that we can adapt the UV lights or the far UV lights along the perimeter of the frame of that metal detector, so that as a constituent person walks through, they're walking through and in between the UV lights where that's surrounding them, and then as they walk through, this UV will actually kill any viruses which is on their person. The other thought I was having is that maybe there's a small UV wand that I heard that's being sold out in Amazon, for example. And if we can place this UV light below the window of the town clerk's office, one below and one above, so as documents are being passed through, we can pass it between the UV light, and at the same token, it'll achieve the goal of killing any virus or pathogens that may be on the document. Could this be possible and the cost more effective?
I'm familiar with some technologies that get close to that type of use. The issue that is going to limit its capabilities in those two scenarios is back to the issue of time. And simply walking through on the one hand, where there are safety issues you'd have to think about, but even just walking through would be insufficient amount of time for it to effectively eliminate viruses if they're on skin or on clothes. For example, there are boxes that some of these companies use that you can put your cell phone in, or you can put your stethoscope in if you're in the hospital. And those are then irradiated with intense UV light, but it still is upwards to 20 to 30 seconds that it's in there being irradiated. And so that's you really have to. It's a mix of intensity and time. And if you really had it highly intense, then you would quickly get into the issues of the safety part of it, as far as what people would feel like if they were being exposed to these types of radiation. So in general, these are devices that can't be used when people are around.
Right. So I have a question, Dr. Anderson. So with that being said, it sounds like, if I'm hearing correctly, this would require like periodic and temporary closing of facilities in order to be, for it to be implemented?
So most likely what would be in a municipal setting would be during the nighttime when the building is otherwise closed, and maybe there's a janitorial staff. Janitorial staff can be trained to use these devices, environmental services, all these groups. If it's a contractual arrangement, then oftentimes those can be included as part of those contracts. And then otherwise, it could potentially be, let's say you had someone that came down with COVID, and then sometimes you may then have to wall off areas or block off areas, and then say, and we're in the process of an intense clean to, ensure everyone stays safe. So those would be, in my mind, the two scenarios in a municipal building setting.
Okay, thank you. Is there any other questions from our council members?
I do have one.
Okay.
Through you, Chair. Just what's the difference between this type of far UVC versus the someone getting a suntan?
Yeah, so UV, a really oversimplified way to think of UV is it's UVA, UVB, and UVC. And UVC is the far UV, and it is what that means with its far is related to the size of the wavelength. And so, 220 to 250 nanometers is a much shorter wavelength. And so as a result, it does not penetrate skin, and it is not the thing that it would be then responsible for suntans and sunburns for that matter. That's much more UVA and UVB. And so some devices actually produce all of those. There's at least one on the market that produces UVA, B, and C. Most of the UV machines focus on just the UVC or the far UV.
And what would the nanometer be for? So if I was to get a suntan, go to.
And it is. Grids.
Okay, thank you.
Okay, our Director Arroyo, do you have any questions for Dr. Anderson? I know he's, I want to be mindful of his time. So do you have any questions for him? Let me see if I can unmute. Let me unmute you. Hold on. There you go. Should be okay. No. Okay, you should be okay now. And I think you have to press your unmute button. Sorry. Okay. Now you should be good, Director. If you press the unmute button. I don't know what's going on here. I apologize. It's something on my end that's not unmuting here.
She said her computer froze.
Oh, her computer froze.
To let you know.
Okay, all right. Her computer froze. Okay. All right. Well, that's the technology that we're embarking on, that most businesses are doing.
I'm sorry, my computer froze.
There she is.
All right, thank you. All right, do you have any questions, Dr. Anderson?
My only question would be, are there any other examples of this being used outside of a hospital setting, even if not by a municipality?
I'm aware of a few other places, such as, I think every once in a while you'll hear of gyms and athletic facilities that are using some of these devices. Certainly in some of the gyms that really verge more towards outpatient medical buildings where they're doing a lot of therapy and things like that. Those would be the other locations that I'm most familiar with.
Okay, thank you.
Okay. So, any other questions for Dr. Anderson? Again, I want to be mindful of his time. I think he has maybe 1 or 2 minutes left. Dr. Anderson, let me see if there's any other questions. All right. So yes.
If I may, I'm sorry.
Yes, go ahead.
Just real quickly, I apologize, Mr. Chair. Just a legal question. If you were happy to know, because I'm always worried about liability. Would there be a disclaimer? Do you know about other facilities that use this that requires a kind of disclaimer? For the small possibility that there is UV exposure.
I'm not familiar with that, mainly because the way that they're being used in those other locations is during those nighttime cleans, as opposed to, wheeling them out when there may be people around. And so it's really the contract with the environmental services company or that group that is doing the nighttime clean. where those kinds of contractual issues and liabilities might come in, that I'm aware of anyway.
Okay. All right. Look like it's any other questions, Dr. Anderson. Thank you so much for taking time out of your busy schedule for coming on with us today. I
Sure.
appreciate it.
My pleasure. Best of luck with everything. Take care and be safe.
Take care.
Thank you, Doctor.
Thank you, Dr. Again. Okay, councilperson. Committee members, is there any motion? Anyone want to make a motion on this agenda item? Anybody want to make a hand gesture?
Motion for favorable recommendation.
Anyone second?
They're all muted.
If you could unmute yourself. We have a motion in favor of make a recommendation.
Do we have a second on this?
No, there hasn't been a second.
I would just like to have a little bit more discussion before voting on it, because I'm really not understanding what it is that we're looking to do. It looks like the resolved is talking about asking the city to research this. Is the idea that we're asking Director Arroyo and her department to, go out there and take a look at whether any of this technology could be utilized within the city?
Councilman LeBron, can I ask a question?
Absolutely.
I'm wondering, and kudos to my colleague for getting Dr. Anderson in, but I'm wondering, because I've been spending so much time with Leonie, I'm wondering if right now we have the time for something that isn't, exactly what I'm thinking it is. Do we have the time, money, or resources right now to have staff within Leonie's department to spend time doing what needs to be done? I'm not saying we shouldn't do this at some point, but for someone who's gone through what I've gone through today, I like to see our valuable resources in the city of Hartford, at least for the foreseeable future, focused on, the immediacy. I know we should be thinking simultaneously, immediacy, long-term, preventative, but right now I don't feel that I know enough, and I also feel that the department that I've been doing the most work with is just flat out with what we're doing right now, dealing with COVID. That's where I'm at.
So, Councilwoman Rossetti, there was a question for our Director Arroyo. Director Arroyo, if you like to respond to that question.
May I be frank with everyone? I just think that I have a lot of concerns when we're talking about research, particularly for a majority minority community. I just think of just today's article in The Current, that the distrust that exists between the medical community and the scientific community and communities of color, particularly the African American community as well as the Puerto Rican community, just going back decades of the research that has been done to us, not for us. And so I have concerns when we're talking about doing research in the middle of a pandemic, and diverting resources, as Councilwoman Rossetti has said, from the day-to-day work that has to get done to something that may or may not yield what we may want it to yield, and something where we may have to spend money on multiple units because we have multiple facilities throughout the city. It's not just City Hall or DPW or headquarters. We have staff in several buildings that are not city-owned buildings as well. So I am hesitant when I read the resolution as it talked about being a part of research when we're talking about the community that we live in. And I feel very, in many ways, overprotective, being myself a member of this community and coming from a community that's similar to Hartford as well. And so I just have a lot of concerns about that, especially because there's not a lot of research on the use of this outside of a hospital. And when we think about City Hall, we think about some of our other places that this could potentially be in use. We're talking about large cavernous spaces, which the doctor was clear is not necessarily the most effective way to use this. And so I think that those are my concerns. And then just at least from a little bit of what I've read, it is, while it appears that the use of this light and the use of this particular machine that the Duke University doctor was speaking of increases the effectiveness of disinfection. We also know that good old elbow grease and, bleach and hot soap and water is also very effective. And I am hesitant to lull people into a false sense of security that because this exists, that the place is safe. I think we need to focus on the basics. In any pandemic, that is what makes a difference. And so those are my concerns. And Chief Freeman was sends his regards. He and I spoke prior to this. He was unable to make it, but he also shared concerns around doing research on our community, considering that we are 85% people of color in the history of research that exists, of medical research within the community.
Thank you, Director Moyo. So I know you guys both raised your hand at the same time. So Councilman Sanchez, I don't see Council President Rosado. So Councilman Sanchez, your question?
Yes, being the author of this resolution, and I want to thank all supporting me on this. Maybe I used the wrong terminology, but when I say research, I'm not talking about using our folks as guinea pigs, researching and see what effects it has on our community. What I am looking for is to acknowledge, because the research is already done out there. I'm surprised that the doctor didn't recognize and realize that they are using this UV to disinfect aircrafts now. And there's a robotic system that's controlled, as he says, is remotely controlled. So this technology does work. The research is out there. I'm not looking for the health department or any other department to do the actual research itself, but only to look for the research that's already been done and to acknowledge and find a way where we can implement this technology, and basically not to replace the basic needs of soap and water or disinfectant, but just to add another level of security for our health. And just as he said, we can scrub and clean and everything else, but what the UV does, it actually reaches in corners and areas that, whether it's cavernous or not, you can always bring it closer to the surface, but it reaches the areas that we can't reach ourselves. So that's part of the UV lighting system. And basically, again, just going back to what I said, it's another added security that is, and if you read this research that's been done, you'll see that it is effective.
Okay, we have a Council President Rosado.
Through you, Chair. I just wanted to ask, so based on what I understood from Dr. Anderson, when Councilman Sanchez said, he referenced the example about putting these UV lights, at the clerk's office, on the top and on the bottom of the protective plastic glass, or at the Capitol when one walks through the metal detector. Am I correct in saying that what Dr. Anderson said, just walking through a metal detector through these lights will not kill any bacteria?
Because of the time.
Right. So actually putting these lights in different parts of a city property, people are walking in or documents being passed back and forth, this wouldn't be effective at all, based on what he's saying.
Correct.
Now, having a robot, running through City Hall all night, then that perhaps might be effective, is what he's saying, for a period of time. But then that robot would have to go into places that we can't even go into in order for it to work. So I understand the research and I supported the resolution, but based on what he's saying, does it make logical sense that we do this research on this process based on what he said?
Well, again, I'm not asking for that type of research because that type of research on UV usage is already out there. It's already done by colleges, universities. The reason why I use the word research to search for those researchers is basically simple, just to reach out and find out what research has been done.
Okay, so what would
And then to your point,
your goal would be to see these lights placed all over the municipality?
no, that's not what I'm looking to do.
Okay,
Basically, for example, if we were to get a robotic system, okay, although we can't enter certain offices, the UV light can be used on the entryway, door handles, on the floor, on counters. So that would probably be, what can be applied.
okay.
But as far as the, the documents and all, it is, to his point, is a combination of distance and time. So, for example, at 222 nanometers, you can be 2 feet away from a surface, and it takes 10 seconds to kill any pathogens or viruses. This has been proven. But on the other hand, all right, as far as people worrying about getting skin damage, that is the lowest, which is considered far UV, so it doesn't cause skin damage. Versus if you was to go to a salon and get suntan, that's double. That's over 400 nanometers. So that's dangerous. But yet people, not to make it as a reason why we should still move forward, but hundreds, if not thousands, of people get a suntan on double the amount of what we're asking for, which is the far UV. So also, as he mentioned that, in the hospitals, I guess they have a container and they can put their cell phones and all, and it has a UV system in it where they can disinfect the cell phones or whatever they have on their person in this container. And that also, because it's so close, it should take a matter of seconds to disinfect whatever it could be on the product. So basically, again, it's not an actual research, but it's just to search and find the research that's been completed to prove, or at least to accept, a UV system as another level of security for disinfecting.
So should we take the approach of writing this resolution?
I'm sorry, Kent.
Should we take the approach of rewriting the resolution?
Sure.
So we have a motion, a favorable motion, but we've had some committee members in terms of who have some thoughts. So I just let me add my thoughts. I think that a couple things. I think from a health and human service perspective, I think that our thought process around this virus has been evolving, and it's been evolving every single day. I think Director Arroyo has said that, and you see the response that happened, that changes. One of the things that I want to highlight is the fact that 2 months ago, folks weren't required to wear masks. And now it's required by the governor that folks, when you're outside, to wear masks. And so as it evolves and as it changed, so does our thought process and our ideologies around science. So that's the first thing. The second thing is, it sounds like at Duke University that they already have implemented these robots and that they're fully functional. On the contrary, I think a couple things. The other piece is in terms of our budget system and where we are with not budget system, but our budgetary constraints is, I think he mentioned anywhere from 5 to 15,000 for one unit. And to think about the amount of implementation, and my biggest thing would be sustainability around the city and all the city offices. I mean, this can be a very daunting amount in terms of how to operationalize it. Then in terms of implementation, folks would have to be trained. The use of these robots would have to be where no one would be there, and so forth and so on. And so, going on the form of technology and science, but then on the other end, him also recommending that it doesn't replace the elbow grease. So, and the work that would need to be done, I continue to think about how costly this can be, number one. And then number two, at this moment, at this time where we are with this pandemic, what the amount of attention and human capital hours in terms of hours devoted to this, to see if we can implement this. In terms of the other thing too, is that what this may provide is a false sense of security. And that although the guinea pig statement may not be it, because it doesn't sound like the research piece, Councilman Sanchez, as you said, it looks like the research already been done. But in terms of the false sense of security that folks may have in regards to, now we have these UV lights. And so how would people take that? How would they measure that? And is it going to lessen or give a mindset that somehow we're safer from doing the basic practices that we have known to be tried and true, which is social distancing, cleaning, disinfectant products, and all those things. So I know I spoke for a long time. Councilman Gale, you had a question or a comment?
Yeah, thank you, Mr. Chair, and I certainly appreciate all of your comments. And I don't know, somehow I lost contact with everybody for a few minutes there. But here's a couple of my thoughts. We're in the middle of this pandemic right now. I am sure that there's going to be a lot of discussion around the country, around the state, around the city about best practices moving forward. But I think right now it might be a little premature for us to be able to weigh what are those best practices, what does make the as a practical matter, what do you get the best bang, the biggest bang for your buck, so to speak. And so what I'm wondering, I mean, I certainly appreciate the intent of the resolution, and I think it is our job to protect the health, safety, and welfare of everybody in the city, and especially those coming in and out of City Hall. But I'm wondering if the resolution isn't sort of better suited to saying that we would ask our health director not to, she's already got a lot on her plate, not to put more on her plate, but to say once the pandemic is over, at that point in time, should there be some report that comes back to council to say how the city fared, whether we had, what we had in place for safety measures, and most importantly to the resolution, what we could do in the future, whether, our health director would recommend buying UV robots, for instance, or getting us other things. I'm just, again, I'm thinking out loud, but I'm kind of thinking this might be a little premature. And what we would really want is for our administration to come back with a report, having gone out, to Councilman Sanchez's point, gone out and looked at different research, but then come back and given us sort of a smorgasbord or a report. There's UV light, but maybe there's also this and there's that and there's 6 other things. Anyway, my thoughts.
I can't hear you.
Nick.
Yeah, I got it. So you guys came up with your hands at the same time. So
go ahead, Mally, and then I'll talk.
And
Sure.
then Councilwoman Rossetti.
Right. So I hear everyone's concerns and opinions on this. I'm for one, I like to be proactive. I know that, I've heard some opinions about, maybe like Councilman Gale said, in the future we could get a report back. But I'm also aware of, I've gone in and I've done a lot of research on this UV light, and I've seen what these robots do in the medical field. For crying out loud, you go into Super Stop and Shop. Like, robot is like the new future of technology, right? So understanding that there will be available, I'm pretty sure, a lot of federal funding and perhaps a lot of grants for research like this. And I'm wondering if we put something forward now, and not as a top priority, but keep it on record that we have done X, Y, and research, and a grant happens to come up, that we have something where we could apply for that grant and have some research to it.
Thank you. Councilwoman Rossetti.
what everybody said about what we're doing, but again, I'm going to go back to, just because of what I've been doing with Liani, that even as what Councilman Gale just said, you know, some type of, you know, looking at what we're doing, and to my colleague, Councilman Sanchez, I'd either like us to postpone this for now, maybe take an opportunity to rewrite it. I just don't want to, because of what we're doing in the middle of, and because I feel it so acutely, I don't want to put any undue more work, even though this is a really interesting idea on the Health and Human Services Department. So I would like us to find a way to either to Jimmy's, as somebody said, rewrite it or postpone it or come back at a time, not a report right away, so they have to do it right away, but in a few months when we have an opportunity. So I'm throwing out there some different suggestions.
Thank you, Councilwoman Rossetti. Councilman Clark?
Thank you, Mr. Chair. Through you, I supported this resolution by my colleague, Councilman Sanchez. I think it's something innovative. And trust me, somebody such as myself and along with Councilwoman Rossetti have been in the thick of things, which I know our director, Liani Arroyo, can attest to, and definitely don't want our health director and her team to be burdensome. But I think this is the type of innovative ideas that we need to be taking a look at. And I don't think it was the intent of my colleague, Councilman Sanchez, to have us as guinea pigs with something of this magnitude. But I would say that because of that's been going on, and with respect to not knowing when this thing is going to plateau, if you are looking at some certain news articles and reports that close to the fall, when flu season is back, that this is going to collide with each other. So I do agree with my colleague, Councilman Gale, that if it's something that my colleague, Councilman Sanchez, would agree to, for us to postpone this, to rewrite it, and then come back with a new resolution.
Thank you, Councilman Clark. So in terms of processes, I'll get to you again, Councilman Sanchez, and I'm mindful of the time as well for you. So would you have to then withdraw the motion of the favorable motion and then another motion be submitted or proposed?
Well, there was no second to my initial motion.
Okay, thank you. Thank you, Councilman Clark. Councilman Sanchez.
I appreciate everyone's input, and I truly believe you guys understand why I put this forth. And thank you, Council President, because it is a resolution of being proactive than reactive. I mean, right now, we're not even in the peak of the situation of this pandemic. I would hate for this to continue and still not reach our peak in months from now. And to your point also, this doesn't have to be a priority. And I feel that if we do submit this and pass it favorably to the council so it can get voted in, at least it's there on the table, it's passed. And if there's any kind of funding or someone else can, support and looking for those researchers in support of applying for a grant so that we can start sooner than later and implementing this kind of technology. But, I am in favor of what, the majority decides. If you feel that I should withdraw it and redraft it so that the language is better. But at the same token, again, it's not something that has to be a priority. And I wouldn't want to add more on Liani's on your plate. Trust me, I know you're doing a tremendous job and above and beyond, and you're overwhelmed, and as well as most likely Chief Freeman as well. But that is not my intent to add more to your plate, but rather just to start thinking outside the box. What else can we use to help curb this pandemic, because I believe, and it is only my opinion, that this is not going away soon. It is not. This is going to be with us until next year. And have we reached our peak? I do not believe so. So is it something that I feel that we can implement to curb or at least add another level, although folks may be untrusting? Yes, I believe it can be done. But again, I'm more than willing to change the language on the resolution. If you want, I can withdraw the resolution, or we can postpone it until I change it. I'm leaving the decision up to you.
Okay, Councilman Clark.
Thank you, Mr. Chair. Through you, motion to postpone.
Okay, we have a motion to postpone. Does anybody second? Councilman Dale?
Second.
Second it.
Okay, so we have a motion that has been properly second. Now we vote, right? So we can have a vote by everyone in favor of postponing this resolution. Let's go with you, Councilman Rossetti. Councilwoman Rossetti, sorry.
Yes.
Councilman Clark,
Yes.
Councilman Gale,
Yes.
and myself, Councilman LeBron, I vote yes. All right, so the agenda, resolution item, on agenda number 2, resolution item regarding the UV light has been postponed with the hopes of possibly looking to rewrite it in the future. Thank you. Okay. So bye, Councilman Sanchez. Thank you for all your consideration and being proactive and all your energy towards this.
Thank you, everyone. I have another WebEx meeting, and that's why I have to go. So I appreciate your support. Thank you.
All right. So thank you, Councilman Sanchez, again. So we're going to move to agenda item number 3. The Health and Human Services Committee felt it was pertinent to have our Health and Human Service Director kind of give a brief update as to where we are. We've had a lot of movement since Friday to today regarding the reopening. We had the mayor's teletown hall in both English and Spanish, where updated information has been given. And so there's probably a ton of information that you can share, but if you can kind of give us the highlights. But before we go there, Dr. Arroyo, what I want to do is acknowledge, I know this is a Health and Human Services Committee, but I want to acknowledge the chiefs. I want to acknowledge Chief Freeman and the Hartford Fire Department for their Herculean efforts in terms of all that they have done for our city, being first responders, and just a tremendous effort by them and the statistics that they provide. I also want to thank Chief Doty and the police department for really implementing and being that presence out in the community while all of this was going on. As a community, we were reacting to social distancing, and people were reacting and understanding the pertinent information differently and processing differently and what it meant to them. And so, I mean, it was just a difficult task for the police department. I want to thank the chief for his leadership. Both were not able to make it here today, but they're welcome and invited in the future to talk about their health and human service perspective. So I definitely want to acknowledge them. And so without further ado, I want to give the floor to our Director of Health and Human Services, Liani Arroyo. The floor is yours.
Thank you. Thank you, Councilman Lebron. My mom thinks you were calling me a doctor. I am not a doctor, though I play one on TV.
I thought I said director.
You said doctor once, but I play one on TV from time to time.
You play one on TV. That's what
I play one on TV. Thank you all. Obviously, now a little over 8 weeks since we last met, the situation has obviously changed quite a bit. 2 weeks after we last met, the city of Hartford had its first coronavirus case. That case was really essentially our first run at how we were going to react to this and how we were going to move forward. Immediately, 24 hours later, we had our second case as well, and we continued that run. And as we've gone through those days since March 14th, from being aware of our first case till now, the situation has changed quite a bit. At that time, when we met on March 1st, I told you there's a lot of things we don't know about this virus, and there's still a lot of things we don't know about this virus. And I think it's important to recognize that. Every day we learn more, and every day we get better information based on the research that's happening and what we're learning from different countries around the world. At this point in time, you should have received the briefing document that we create every morning out of my shop that my epidemiologist, Tu Nguyen, creates. We are currently at 1,174 cases. That was as of this morning. I'm sure the governor's report, which usually comes out in the evening, may have adjusted that number, but as of this morning, we were at 1,174 cases in the city of Hartford. While the number continues to go up, which we would expect, the rate at which it's doubled has slowed, which is good news. So we continue to get more positives, but the rate at which the number has doubled has slowed. We have 372 Hartford residents who at some point during the last now 7 weeks or so have entered the hospital. That is the cumulative number, not how many people are, not how many Hartford residents are currently in the hospital, but those we've had 372 of our residents enter the hospital at some point over the last almost 7 weeks. And unfortunately, we've had 96 residents pass away as a result of the coronavirus. The numbers were raised upwards about a week or so ago. There was a jump in the numbers at the state level. We saw a little bit of a jump here in the city as well. As a result of that, there was a change in how deaths were counted. Some states only count lab confirmed cases, but there was a change here in the state of Connecticut that was not only counting lab confirmed cases, but in recognition of the fact that tests were not being done in the manner that they should have been done. We are also counting what are called probable cases of coronavirus in that death count. So for instance, if you had a loved one in a nursing home who was unable to access a test, but had many of the classic symptoms and passed away, the doctors at the nursing homes, the medical professionals and staff at the nursing homes are noting all of that information in the record so that it can be counted as part of a death related to coronavirus. The final numbers will obviously come from the Office of the Chief Medical Examiners, So, we will have to wait and see where we actually end up in terms of number of deaths that were directly attributable to the coronavirus or that the coronavirus played a part of. Overall, we've had 2,638 individuals in the city tested. That is slightly over 2% of our population. Given the number of positives we have and the number of individuals that have been tested, we have a 44.5% test positivity rate. That is entirely too high. There's two reasons for that we believe. One is the shortage of testing that shortage of testing kits that occurred earlier, and where we were only testing individuals who were in the hospital initially, and then increased that to folks that had symptoms. And now that has been further opened up for testing, where you don't have to be symptomatic in order to obtain a test, given the new partnerships that have been created at the hospitals with different labs. So that's good news on our end, that we have the opportunity to have more people tested, and we will continue to work with our hospital partners to increase that and really focus in on moving resources and moving testing to areas that we know are hard hit. When we look at the demographic data that you receive on a daily basis, it's imperfect data. About a third of the individuals, we have no race or ethnicity data for them. It is my belief that a large majority of them will end up being people of color, but we just have a third of the people that are being tested where we don't have their race and ethnicity. So we can't really say whether our people are being under-tested or over-tested at this point in time, because we just don't have accurate data. But hospitalizations is a little bit different. Although we are missing data on hospitalizations, we do see a higher rate of hospitalizations amongst African Americans relative to their population size in the city. So that's obviously something that was of concern to us. It's been a concern to us since the beginning of this pandemic, of how do we ensure that those that are most vulnerable, that have the most challenges, that bear a bigger burden of chronic disease in our community are taken care of. So that, you know, you've seen the efforts that we've been making with regards to the communications campaign, to the mobile testing with Hartford Healthcare, as well as working with the University of Connecticut students to place phone calls. We continue to do contact tracing. I've been asked several times by several different individuals whether we're doing contact tracing. We most certainly are doing contact tracing. It is not the traditional where you're doing that really in-depth 1-hour interview. We've shortened that a little bit, but as we obtain information on positive test results, we will reach out to individuals as swiftly as possible, and then have a conversation with them about the steps they need to take, as well as where they might have been in the last 2 weeks. And so when we know that they've been in contact with large groups of people at an at their employer or other places like that, we will reach out to those employers and inform them of the steps they need to take. We expect to continue to do that, though it is a lot of work with the number of cases we have. We believe it is critically important to at least make the attempt to do contact tracing. So our contact tracing, right now, we have 3 people working on that pretty much full time, 8 hours a day, 5 days a week. And we make 2 attempts to call via telephone. If we do not receive an answer, we then mail a letter. And people do call us back when they receive that letter as a testament to our community and knowing the importance of mitigating the spread of the virus. So we continue to do that work. The department continues to also identify ways to make sure that our most vulnerable are taken care of. I think you could all see that our work with our homeless community and our homeless service providers, we were at the forefront of that work here at the state level, across the state, where other folks were looking at the work that we were doing to inform their work. I think we were very lucky to have great partners with the Coordinated Access Network, as well as with our shelters, who were very flexible and willing to try new things and do things differently in order to ensure that these most vulnerable populations were taken care of. You know, it started with moving first on the city's dime those that were most at risk for bad outcomes into hotels. The state then took over that for us and used that model across the state. We have an isolation center here at the city. We have actually 2 facilities. One is smaller. We were spending initially some time at a 10-cot facility, and we've now moved into a larger facility that has 35 cots. So we have an isolation center for that. Over the past 6 weeks, we've had about 6 guests there, and various of them are now on their way to be able to leave the facility. So that's great news. But that's some of the work that we're doing and continue to do. We've implemented a transportation program. Originally, it was going to be for our shelters and our homeless residents to be able to move between isolation facilities in the shelter or for testing, but we've expanded that to all residents in the city. And that's obviously critically important for a city that has about 1/3 of its citizens without access to a personal vehicle, and the fact that we don't want people on public transportation if they're sick. So we've done quite a bit over these last 6 or 7 weeks. We've learned a lot from what we've seen other cities do, and I believe we are much better prepared to move forward and to do this work. There's always room for improvement. There's always places that we can do more and do better. And our team continues to work and look for opportunities to access additional funding so that we can do paid media and do additional work around communications, looking for additional funding around testing and how we can support our FQHCs get the materials they need. Our department has also been a distributor of personal protective equipment. Chief Freeman is the primary person who is overseeing our supply of PPE, but the department itself gets a small supply of personal protective equipment from the Department of Public Health at the state level. And we are providing that PPE to home health care agencies in the city and to our one urgent care facility. We will likely be extending that as well. If there are personal providers doing emergency work, such as dentists in the city, we may be able to supply some nominal PPE. What we distribute is based on the priorities that the state has outlined, and those priorities are really focused on home health care agencies, dialysis centers, and urgent cares, as well as providers of emergency medical care, private providers of emergency medical care. So we continue to do that on a weekly basis based on how much supply we're getting from the Department of Public Health. There's lots of other little things that our department does, but it is truly a team effort every morning. Boz, myself, the mayor, Toon, and Chief Freeman meet anywhere from 20 minutes to sometimes up to 45 minutes or an hour to start our day with what the latest is, what the latest and greatest is, and then move forward and make sure that we're staying connected. And those conversations happen numerous times a day. But that is the work that we're doing. I'm proud to be a part of the team here at the City of Hartford. We have a very dedicated group of individuals, and we continue to move forward. Councilman Lippman, you're muted.
I'm sorry. I got to follow my own rules. Thank you, Director Arroyo, for that very comprehensive and very insightful. I mean, it's truly such a tremendous and daunting effort that you guys have taken on, and it shows. But I think we have some questions. So, Councilman Gale, did you have a question?
Mr. Chair, Leonie, one question, one comment. In addition to all of the services, all the fine services that are being provided by the City of Hartford, and the shout out that Chairman LeBron gave to all our various departments, let me just add the Department of Public Works and the guys that are out there picking up the garbage. And my question has to do with DPW, but also the police and the fire. I know that we've gone through and many of these employees have been tested. Do you feel that you have an adequate access to the appropriate amount of testing so as to be able to keep our employees safe as they continue to go out there and keep us safe?
I would say absolutely. We have, we partner with Trinity Healthcare. They are our occupational health provider for the City of Hartford. We have a contract with them to do that work. We have expanded our arrangement as it relates to testing to ensure that those individuals that are essential employees and personnel for the City of Hartford have access to testing as needed. So that is already happening. If there is a employee that has been exposed, they can simply call the occupational health line, make an appointment, have that conversation, and get an order for a test through Trinity Healthcare. So that is something that's already in process. That was due to the leadership of Thea Montanez, our COO, who sort of rallied all these different efforts that were happening and brought them all under one umbrella. So we do have a process and a procedure for that. It starts with a conversation with your director. So at that point, that conversation happens and then testing can be arranged. But I do believe that given the expansion of testing and this relationship, this new procedure that we have with Trinity Occupational Health, that anyone that has needed to be tested has been tested. I do want to caution though, you may have been exposed at one point in time and then you're tested and it comes negative, but it may be that there's just not enough antibodies in your body from the time you were exposed to the time you got tested. So that doesn't always necessarily mean that you're clear, right? It could just, and that one clear test doesn't mean that you can't be re-exposed and then test positive later. But in the instances where we've had employees that need testing, we've been able to make that happen.
Well, glad to hear that. If I may just follow up, I don't know why I'm getting. Anybody know why I'm big echo?
If anyone's unmuted, they should mute. I'll do this.
Okay, let me try again. That sounds better. Okay, so my comment, I happened to see a bunch of statistics today. I get reports from some of the nursing homes, and I got a report on every nursing home in the state of Connecticut today. I don't know how old the information is, but of course I immediately went to Hartford to see how we were doing with the 4 nursing homes that are in Hartford, and it was very dramatic. Avery Heights seems to have 0 in terms of deaths there, and the other 3 nursing homes, Trinity, Park Place, and Chelsea, all they seem to be all having some issues, of course. And so my comment is, at some point, I guess, you know, again, not today, not tomorrow, but at some point we need to sort of look at what Avery did differently than the others. But I recognize there could be 100 different reasons why that seems to be the case right now. Anyway, thank you.
Thank you.
So I was just going to add on the nursing home. I think, you know, it's just sort of the luck of the draw who got the first case, right? Avery Heights does have cases now, and I believe they may have had a death or so. There is a newer report that came out, I believe, late last week. So there is a new report that's come out. They have now also been affected by COVID-19. I think the nursing home issue is obviously one that is very much at the forefront of our minds. As a city health department, we don't have oversight of our nursing home facilities. That is through a licensing division at the Department of Public Health, but the mayor has been in personal contact with the facilities as well as with the president of iCare, who oversees the 3 of our 4 nursing homes. We've had at least one phone call as a group with all nursing homes, and continue to be in contact with them as we see cases come in. I think the big thing is, you know, if you look at nursing homes, it's almost looking like at schools and at daycares. There's a lot of, in a nursing home, you have a lot of people that are just generally ill. And once it gets in, it's really hard to root out. And so I think that's what we're seeing. It's not unusual what's happening here as what's happening in many nursing homes across the country, unfortunately.
All right, I believe I have other hands. Any other questions? Yes, Council President Rosado. Oh, hold on, let me unmute you. Hold on.
Thank you.
Yep.
Through you, Chair. So talking about the nursing homes, and you know, I'm going to say it publicly. I'm very concerned with the nursing home. As many of you are aware, my father, you know, tested positive. He's doing a lot better now. But you know, the patients at the nursing homes, they're there all the time. So it's the employees that come in and leave who actually bring in the COVID-19 into the nursing homes. And so, you know, and perhaps you can enlighten me, and this is a conversation that maybe we should have, you know, offline, is do you see it, is it in your opinion that you see that the state is now being more aggressive towards the issues of the nursing homes since, what is it, Kelsey and Windsor kind of put the state of Connecticut out there in the map as being the second or the third most death in the nursing homes? As of last week, nursing homes were getting at least only 5 tests per week. So could you shed some light on that?
So, you know, the testing home issue as it relates to getting tests and things of that nature. So last week, they were being provided 5 test kits. Each test kit can test up to 3 individuals. It is my understanding that they have more access now at this point in time. You know, we were not made aware of that last week when we had our calls with DPH, but it's my understanding that more tests are being made available so that those tests can be conducted on site rather than trying to transfer someone to a hospital for a test or try to get someone that may be sick through a drive-through testing facility. So they have, my understanding, more access. You know, I think DPH tried to be a bit more aggressive originally, but there was an outcry from family members. Family members did not want their individuals or family members in a nursing home that were COVID positive to be moved to another nursing home. There was a big uproar about that. And so I think, you know, you're balancing the needs of families and the fears of families against the public health pandemic. And I think they tried to thread the needle, and they're doing the best that they can in this situation. I think now that we've seen at least the COVID-only nursing homes be a little more successful, I would hope that as this moves forward, we can be a little more innovative around that. But I think our commissioner wanted to be much more aggressive, and there was a lot of pushback. And so I believe that the plan was scaled back a bit. But again, I think now that people are seeing what's happening as a result of that, they might be willing to reconsider for the future. And to your point, you are correct. It is individuals from the outside, and that was something we did broach when we spoke to our nursing homes about sheltering in place. But if you think about the individuals that work in nursing homes outside of the medical staff and the nursing staff, it is primarily women of color, right? When you look at LPNs, CNAs, the janitors, and the techs, it is primarily women of color and people of color. They have families that they have to get to. They have children at home that they need to attend to. And so requiring them to stay on site is not also fair to them and to their families.
Thank you, Director.
Do we have any? Councilman, the floor is yours.
Thank you, Mr. Chair. Director Arroyo, thank you so much for your report, your hard work, your diligence. It's I just commend you all and your staff on the hard work that you're doing day in, day out, along with the collaboration with the state's DPH department with Commissioner Coleman Mitchell, as well as Chief Freeman in the mayor's office. Could you just, for the sake of time, because I know everybody's tired today, but just talk about the partnership between the city and our federally qualified health centers, and just if you could expound a little bit more as to the work that Hartford Healthcare is doing. We saw that Hartford Healthcare was over at the Open Hearth last Monday, I believe. And I've been hearing about them moving into the northern part of the city, but not sure. But if you can just talk about that too. Thank you.
So as this pandemic has gone on, we've the department started with our most vulnerable communities being our homeless shelters, right? Just sort of the fact that they live in congregate care, they're in big rooms in dormitory style, and have continued to sort of move down the scale of vulnerability and continue to meet with new partners. So on a weekly basis, we're meeting with our federally qualified community health centers to assess a couple of things. First, ensuring that they're still operating and hearing from them what services are still operating. And I'm very pleased to say that everyone has still been operating, has been providing services to our community, which I think is amazing considering everything that's happening. So kudos to our federally qualified community health centers for the work that they're doing to help our community. I would also say that we assess what their PPE needs are. Although we are not a provider of PPE to them, that supply is coming from the Department of Public Health at this point in time, directly from the Department of Public Health in this time. We want to know what those needs are to ensure that they can continue their operations. So all of the CEOs do provide me with an update on what they think their stock is, because if there is an immediate need, we may be able to step in until they receive additional supply or help them find that additional supply if necessary. We've also extended ourselves as part of our work that if they were short on a particular item and we were making an order, that we would include that in our order to make sure that they can get over that hump. Thus far, we've not had to do that. It appears the fact that everyone has scaled back in-person services has obviously preserved personal protective equipment. And I think it's a testament to how quickly everyone was able to sort of turn to telehealth, which is obviously very new for many people and many members of our community as well. But, we didn't want to get to it this way, but we did it this way. And I think it's going to be a welcome change for many of our community members who may not always be able to get to the doctor's office or have a long trek to the doctor's office. So we continue to partner with them. One of the areas that we've discussed with our community health centers here in the city is the opportunity to expand testing at their facilities. You are all trusted members of the community. You are a place where many of our community members get their care. Let's be frank, there are not many sort of freestanding personal providers in the city. You're either federally qualified community health center or attached to one of the hospitals. So our people are getting their care at these facilities. And so we want to make sure that they're a part of any testing plan as well. So we're looking and seeing and having conversations with different companies around testing to see what's the art of the possible so that we can partner with our federally qualified community health centers on any of those efforts. Our partnership with Hartford Healthcare came through our conversations with Sarah Lewis, the VP for Health Equity there. She and I have been in constant contact since the beginning of the pandemic. to really talk through the needs of vulnerable populations. And so when they had gotten together their sort of mobile testing strategy and gotten their approval and sanctioned by Department of Public Health, she immediately called me and we had conversations about where would be the best place to start. And we really felt it was important to start with our homeless shelter population, particularly those that were still living in a congregate care setting and in a large facility. So Open Hearth made the biggest sense because our other shelters have what we call deconcentrated into hotels, into our local hotel, where they have max 2 people per room. So the risk of spread is obviously more minimal than, you know, having 80 men on a floor or 40 men on a floor in the McKinney shelter, right? So, you know, we were able to bring that. We are looking to expand testing in the North End, but also across the city. When you receive our epidemiological report, you see that there are hotspots. And those areas are really, if you notice, just there's one spot in the North End, one spot in the South End as well. And so we're really looking at how do we concentrate that. The other 2 spots that you see that are very, very bright are where our nursing homes are. So, you know, that's as we're looking at that is what we're looking to guide our work. And then also looking at places where there are large concentrations of people. They might not shine brightly on the map, but we have some concerns about how many cases we're seeing there, and could we get in there, do some testing and mitigate the spread. I think it's important to know, as the mayor has stated earlier, if you are asymptomatic, you can now get a test. And so we encourage people to do that, because part of the reason we have such a high positivity rate is we're only knowingly testing people that are sick rather than testing a large number of people, so we can get a better idea of what the spread is in our community.
Thank you. Being mindful of time, and I understand that folks have to sign off, but I do have a couple questions as it relates to, and hopefully they won't take too much of your time, Director Arroyo. And so the first thing is that, you know, the governor has mentioned the date of May 20th to, you know, propose reopening of the state or soft reopening of the state. I'm not sure of the correct language. So the first question is what is your thoughts on the date of May 20th and how it pertains to Hartford?
So, you know, I will defer to our governor on what he sees. He has established a group of very noted experts at the state level who are guiding that process. We at the local level have input through the Department of Public Health and the state epidemiologist, Matt Carter, who participates in phone calls with us twice weekly. So we are providing that information and our concerns to him. And I believe our biggest concern from the beginning has been testing. So testing is the biggest one, but that is being addressed. It's not been completely addressed, but it is being addressed. And so, you know, I think it's important for us to, you know, look to the state. We can't have a situation where one city opens and then another doesn't and another opens. There's just a lot of movement in our state. We're a small state. You know, how many counties we have, and we like to think we're separate worlds, but the reality is lots of people travel from all over the state into Hartford, and lots of people in Hartford travel out of Hartford. And so I think following the state's lead is going to be important here on this. But, you know, we will maintain our surveillance at the city level. And if there's need to ask the mayor to do something different or have more restrictions than what the governor's saying, as long as there's no preemption language, then we will have those conversations with the mayor.
Thank you. So just one last question. I want to acknowledge all the people that have been viewing on Facebook. So we actually have a Facebook question. So the question is, the weather's starting to warm. You know what that means. The weather's starting to warm. There's obviously still this risk. We got this soft opening or whatever language. What message do you have for city residents? You know, we understand like the private enterprises, you know, the businesses, they have kind of directives, but what do you have for like families who want to hold, you know, gatherings? They haven't seen families in such a long time. What message do you have for them in terms of hosting events at their house? How to be safe?
So I would say, you know, we still don't know what kind of gatherings will be allowable under the reopening process, right? I still think at this point, as the mayor always says, we need to work together by staying apart. I don't expect that there will be many changes to some of that language as this evolves. That's why this reopening is happening in a phased approach, right? We're opening this, let's see how it goes. Opening the next phase, let's see how it goes. I would say it's hard not to see family. I will share, I have a grandmother in a nursing home in the hot zone of Fairfield County. I have not seen her since the end of February. I put off a visit to her, and then at the beginning of March, nursing homes were closed to visitors. So I understand that need to see family and that desire to see family. But the biggest risk is seeing family and unknowingly exposing them. So I would say that, think about what you're doing. Think about wearing your face mask and your face coverings, washing your hands, avoiding large social gatherings. And the reason that's critically important, that piece about large social gatherings, is if someone is infected and you're in a large social gathering, you've now infected a lot of people that can infect a lot more people. That can then lead to a situation where we have to shut things down again. And that's what we're trying to avoid.
Okay, thank you for that. So with that being said, I think we're at time. We scheduled this meeting till 7:30. Thank you, Director Arroyo, for coming on and updating us. And thank you to all the council members and committee members. Is there any last words that I want to open the floor to council persons to maybe want to say, have this platform to talk to the broader audience? Yes, Councilwoman Rossetti.
Just really quickly again, Dr. Arroyo, as your mother likes to refer to you. No, really, I call her by her first name because I feel we've been in the field now for the last however many days and weeks, and I cannot say, dealing as all my colleagues have in some way with people statewide and phone calls over the last few weeks, months, that feels like years, that I am so proud of the city that I not only live in and get to serve to, because we have really been, right out of the beginning, as someone, I think Councilman LeBron stated earlier. So I'm proud of the work we're doing. I'm proud of the focus on the communities who have been the most vulnerable. I know we'll continue to do that. As I said, when we had with my other hat that I don't like to mix because I am a council person or executive director, but I will say here, the other day at the Open Hearth, I did say, for the city to be focused on the community of people experiencing homelessness, there aren't a lot of other cities, and I can attest to that would look at them as a priority. And that makes me proud. So I want to thank you again, Leonie, and I want to thank my colleagues, and I want to thank the city, the residents. This is tough, but let's continue. Let's make it through to the 20th. I saw a lot of people on the way into work this morning, no mask, close to each other, talking. It's really difficult, I know. But as someone, I think Leonie said earlier, the quicker we go back, the quicker we may be back to where we were. So let's stick it out. Let's stick it out. It's time. And that's all. Thanks.
Thank you, Councilwoman Rossetti. Councilman Clark, Council President Rosado, any words? No? Barring none. So I just want to reiterate, I know I've stated this previously. I do want to acknowledge also DPW. I didn't acknowledge them earlier, and that's apologies to them. I see them. They're out here. They're putting in work. And they come by my street. I say hello to them, and so I want to thank them too. That's just an acknowledgement there. But what I want to say, and what I've always reiterated, is that I think it's important. I know we have this date of May 20th, but there is light at the end of the tunnel, and I just encourage all city residents to keep up the morale, because that's what's going to get us through. So thank you. With that being said, committee meeting adjourned. Thank you.